Recording?
Yep, it's recording.
Agree.
Could you kindly begin by telling us a little bit about who you are, what gets you out of bed every morning, and what's your mission in life?
Wow, they're big questions, aren't they? My name's Julie Satur.
Yes.
I'm currently a professor of oral health at the Melbourne Dental School, and I began my working life as a dental therapist, which is a title that not many people know much about. In the 1970s, the Whitlam government initiated a universal school dental program right across Australia in recognition that our dental health was pretty appalling and that children's oral health was really bad, and that the Commonwealth government wanted to do something about that. They built a school dental service on the New Zealand school dental service that used school dental nurses. We were called dental therapists. So we were trained to do checkups and fillings and extract baby teeth and do some oral health promotion in school classrooms to improve dental and oral health among children, with the long-term goal that those children would turn into adults and that over many generations we'd improve oral health right across the country. So I was qualified to do that, and I worked in that space for a few years. The school dental service began in the lower income suburbs around Melbourne and in rural areas, and during that time as a dental therapist, the state of people's oral health really bothered me, and I recognised that while middle to upper income people had really good access to dental services, they could afford to buy their dental services and went to private practices and got really good quality care. In lower income communities, that access was not the same, and that me drilling away doing fillings for the next 200 years was not going to solve that problem. So I got interested in why we had that problem and how our system needed to work to get around that problem. So right from the early stages, I became really interested in inequality in oral health and why those people on lowest incomes who had the greatest amounts of disease didn't actually ever get that problem resolved. So everything I did after that was really related to how do we increase access to care for low income people, how do we build a better public oral health system, and how do we reduce disease right across our population. Because filling and drilling, while we spend a lot of time doing it to fix holes, it actually doesn't improve oral health.
What draws you into the field of oral health workforce and dental policy? What do you find most fulfilling about this industry?
Yeah, see, that's a flow on from the previous,
Okay.
because we had these dental therapists who had such tight restrictions around what they could do and where they could work. They could only work with kids in the school dental service, and there was a great deal of capacity to use their skill set across more areas of the population because it was a shorter training time. Dental therapists didn't do everything that a dentist does, they did the more common things. So common sense told me and many other people that if we could translate the successes of the school dental service across more population groups, we could reduce the costs of dental care and increase access to care for lower income people. So drive prices down at the margins, for example, use our public dental dollar in better ways to give more people access to care. So that's really what made me step into the policy space, because I started to look at, well, what are the regulations? Who is deciding where this money goes and how things are done? And are there any places where we could change some of those things? So I got quite involved then in regulation and education and accreditation of our workforces to look at who was doing what did the rules say, how could we change the rules to make the very best use of our existing workforce. Now that brought me head to head with the Australian Dental Association, who were a very powerful advocate, and I spent many years working at all sorts of levels of government to get the regulation around practice for dental therapists and dental hygienists in particular altered so we could use their full skill set for any population group that had needs that matched those skills. So changing workforce models and changing the places they could work and the rules around how they did things.